If you've tried all the different elimination diets, medical protocols, protocols for Lyme, mold, viral, and all the biohacks and not fully getting better, I strongly recommend watching this full interview. I had the pleasure of sitting down with Dr. Bill Rawls, and we talk about what it takes to get to root cause healing and how cell wellness or cellular wellness is fundamental in healing and getting back to vibrancy. I now eat a lot of meat, and so do they. If you want to thrive, you need to eat meat. Meat is required. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private functional medicine practice where we focus on root cause healing, and that often starts with the Carnivore Cures all meat elimination diet. Today, I have the pleasure of sitting down with Dr. Bill Rawls. He is the author of The Cellular Wellness Solution. This book is wonderful in helping you understand how our cells are fundamentally where we can find wellness. Whether you call it Lyme, an autoimmune illness such as MS or rheumatoid arthritis, or mold illness, or some type of chronic viral infection, ultimately, it is our cells that need to be well to get back to healing. And so Dr. Rawls and I talk about that nuance, what it really means to even get cell health, why certain people get sick and others seem to be okay, and what are some of the core fundamentals that make us unwell, and then what are some things that we can do, especially herbal therapies, that can help us restore wellness. In the carnivore space, we are super anti-plants. And what I will share is medicinally, for eons, we have used plants for medicinal reasons. So for very small doses in strong potencies, they can do a lot of healing. At the very end of the video, Dr. Rawls actually makes it very easily digestible or understandable about why using certain plants and extracts and their potency in their full form is what allows us to combat the microbes that may have come into our systems that we are struggling as human cells to rebalance. What I really love about Dr. Rawls' methodology and his protocol and program is that ultimately the goal is to strengthen our bodies, our terrains, and not just use every new biohack that may actually attack or add to the system that we don't know what the downstream repercussions are. If we take a lot of antibiotics and antivirals and antifungals and a lot of these medications and then do a lot of these peptides or exogenous hormones or even thyroid therapies, we do not know downstream what the effects are. Why are we imbalanced with our thyroid? Why are we imbalanced with our hormones? Why are we imbalanced with autoimmune? What is causing the root cause of that? And if we don't ever uncover that, we will never strengthen the body. We can band-aid whatever symptom or illness we're feeling. We can chase a lab number to improve that. But if we don't get to the crux of why the body or the system is imbalanced, we will never have root cause healing and wellness. And so when we stop a therapy or we have additional stressors in our life, or COVID hits or something new hits our system, we cannot manage. And so in this conversation, we talk about how do we support the body while using targeted therapies that will support the body rather than attack it. Hi, Dr. Rawls. I'm very excited to have you on my podcast. For the people that are listening and watching that may not have heard of your work yet, if you can introduce yourself.
Bill Rawls. Yeah. Medical doctor. Been doing this a while. This year, 40 years since I graduated from medical school. 20 years has been in chronic illness, chronic Lyme, this mixed space that we all get confused about. So that's where I am now. And it's been an interesting journey, to say the least.
Can you share a little bit about your own journey? What got you in from, I guess, standard care into moving into this more chronic illness, holistic health space?
Sure.
What was
Yeah.
it about your journey?
Well, it's like most everybody that ends up in this space, we have a story. We didn't just come there because you go through a conventional training of some sort and you find that there are a lot of shortcomings there and you find something different along the way. So I went to medical school, conventionally trained, was attracted to the field of obstetrics and gynecology because it was young, well people, And the interventions were acute interventions, which is what we find in conventional medicine. We still do a great job of acute intervention. Somebody has a problem like a tubal pregnancy or arrested labor or a blocked artery in their heart, we do a great job with that. But 20 years of doing obstetrics call every second to third night, every second to third weekend, like from Friday morning until Monday morning, was just a lot. And in my 30s, I could do it. In my 40s, it started catching up with me. And I was one of those people, if somebody was in labor or I had somebody in the hospital, I didn't sleep. So, average, I got 3 or 4 hours of sleep a night when I was on call most of the time. And by the end of it, my body started breaking down, just everything. And I had to stop doing obstetrics. And I thought, well, my sleep will come back. It didn't. And everything will start working again. And it didn't. And I just kept getting worse. Finally ended up identifying with chronic Lyme disease because nothing else fit. And that's part of that's a short version of a long story. But and now I think of chronic Lyme very differently, and I don't really like the concept of diagnosis when it comes to chronic illness because it defines the medical therapies which don't treat the ultimate causes, and people don't get well. And that's a big problem in our society. So I think about these things so differently now than a long time ago. But along the way, I found herbal therapy, and that was my salvation. And from there, I've built theories and studied the science of not only what chronic Lyme disease is, but what chronic illness is, and why we're falling short in helping people, and why, 60, 70% of the population is chronically ill. That's my short story. That puts things in perspective.
Okay. No, I love it. Thank you. And let's first talk about then, what do you view as chronic illness? I know you have this passion for cellular wellness. What does that mean?
Yeah. Chronic illness, very short, but very specific. Chronic illness is when your cells are chronically stressed. It's as simple as that. So your whole body is made of cells. Everything that happens in your body is the result of cellular functions going on in your body. Whether it's your thyroid hormone being produced, your heart beating, walking across the room, whatever you're doing, what's happening is due to the actions of cells. So when we become sick, it's our cells that are sick. And our symptoms are a direct reflection of that. If you have heart symptoms, it means your heart cells are sick. If you have neurological symptoms, your brain cells are sick and your nerve cells are sick. If your thyroid hormone is off and your thyroid gland isn't working, your thyroid cells are sick. In an essence, what all of chronic illness is, you have to bring it back. So every manifestation, every aspect of chronic illness is rooted in cellular stress and injury and dysfunction, every single bit of it. That puts you in a different space as far as explaining things, but when you put it in that space, everything starts to make sense. And why what we're doing and not making people well in chronic illness, what we're doing, we start to understand why.
And what would you define as the biggest culprits that make our cells sick?
Yeah, well, it gets down to our cells. And yeah, that formula for wellness. I spent so many years trying to figure it out. And I started, one of my things when I started searching outside of conventional medicine was looking for causes. And, we start looking at some obvious things. Dietary, that's a big thing. What people are eating, that affects your body. So there are a lot of, so diet is a big factor in chronic illness. We're hearing more and more about environmental toxins because our world is saturated with toxic substances, mostly petroleum and coal derived from fossil fuels that we've never been exposed to before. Mental stress, we know that's a big one. Being sedentary, and everybody knows that microbes are always out there to get us. But it brings it down to a basic formula that I use that it took me 20 years to make it this simple. But when you think about your cells, every cell in your body came from one original cell. So that one original cell, when you were made, diversified into all the different cells in your body. And then you grew more and more cells as you grow up and became an adult. But all cells are independently functioning units. You can think about them as little microscopic machines, little biological machines. So, like any machine, they have operating requirements. Every cell has operating requirements. So, when you look at it from that point of view, all the cells in the body are structurally very similar. And they may have been modified to do different jobs, but they all came from that one cell. So, they basically are structurally similar. So, every cell in your body needs the right nutrients. So, that comes from what you eat. And so it's really important that all the cells in your body are getting all the nutrients they need. So some cells, like your thyroid hormone, your thyroid cells need iodine to produce thyroid so hormone. Your heart cells run predominantly on fat. Your brain cells tend to do a little bit better with some carbohydrate. So all of our cells have different requirements, but if we're eating a diverse diet of whole foods, really important, then we're giving all of our cells what they need to function. So that's number one. That and not getting that defines nutritional stress. That's a big stress factor. Number two on my list is environmental stress. So, what I mean by that is substances in the environment, and these can be natural substances like mycotoxins from mold, but also all the unnatural toxic substances that we're exposed to that are sourced from some fossil fuels. And all of us are getting that at much higher levels than we ever have before in human history. So those things basically in our body are absorbed into our cells and they basically inhibit cellular functions. Our cells, they block the way our cells work. So our cells don't work as well. They become dysfunctional. They can't do their job. So, and on top of that are all the unnatural radiation that we're exposed to, all the EMF and everything else. So toxic environment. Number three, mental stress. When you're stressed, like I was, you don't sleep and you put your body in high alert. Well, your cells work hard and they work hard during the day, especially. So they need time to recover and regenerate. Using a process of autophagy, they regenerate continually, but they need downtime to do it best. Now, some cells, like our heart cells, have to do that in between beats because our heart never stops. And that's one reason our heart cells are so vulnerable. But most of our cells need a good 8 hours of sleep to recover. So if you're getting 6.5 hours, like most average Americans, you start your next day with a deficit that your cells haven't recovered from the day before. And that becomes cumulative. And that's what got me. So, that thing of mental stress, being in high alert, keeping your body engaged in high alert doesn't give your cells the time to recover. So, you're always at a deficit. You're always running behind. So, that's number three. Number four is good blood flow. So remarkably important. So our cells are nourished by fluid that comes from the blood called plasma that circulates out of the blood and carries nutrients and oxygen. It also flushes away toxic substances and metabolic waste that cells are trying to purge and washes it into the lymphatic system. Well, that space in between our cells is really, really tight and it becomes congested with debris from dead cells and microbes and all kinds of stuff. And if you're not flushing that, your tissues are constantly congested and your cells start to suffocate. So we get good blood flow by moving, by exercising, by being physically active. And it's so essential. And, I read something yesterday that really only about 7% of Americans are physically active to the degree they need to be. I mean, it's just terrible. So we're not moving. And then the last thing that threatens our cells, and we'll go into this more deeply as we go along, is microbes. That's our arch enemy. And when we look at microbes, viruses, bacteria, protozoa, yeast, they're a threat because we have what they want, which is food and resources to replicate. So basically, our cells are food for microbes. And so we're constantly encountering microbes that are trying to get inside of our body to basically use our cells as a food source. And that's a formula for wellness right there. And so it's those five factors. That's it. And I've refined this model for 20 years. That's all. So when we look at that last factor that people talk about, genetics, what genetics does is modifies how we tolerate those different stress factors. So, one diet may be better for one person than another. Certain toxins may be more effective to some people than others. So I don't consider genetics as much a causative disease as a modifier of those factors. But that's wellness in a nutshell. So, if you're staying ahead of the game with cellular wellness and really affecting your cells in a way that keeps them healthy, you're gonna be healthy. You'll feel great.
I love it. Thank you. That was such a great explanation. And I think in a former life, you must have been a teacher because that was really good. So
You,
one
you
thing
know,
I'll
it's
go.
I do enjoy teaching.
Okay, okay.
I do consider myself an educator, but it took me 20 years to get that simple explanation. So a lot of these things are hard won. But yeah, it is that simple.
So would you say that it's the first four, I guess, levers that then cause some people to fall into chronic illness because maybe the microbes then we become much more vulnerable to the fifth one? I'm only asking because while everyone's health is somewhat declining with our modern toxins and our food and all the things that are going on, there's only a subset still that become really chronically, obviously ill. What is that differentiator, you think?
Yeah. The microbe factor can be really interesting and it depends on the microbe, right? So some microbes have a strategy of breaking down the door and grabbing and taking what they want. So if you get a bad cold and a virus, and on top of that, get a pneumococcal bacteria, boy, that thing is really aggressive. It's turning over every 20 minutes. It can make you sick very, very fast. And for that sort of thing, acute infections, acute bacterial infections, acute viral infections, antibiotics are the right solution. But that's a very different kind of microbe than we're exposed to most of the time. So most things that we're exposed to are very, very stealthy. And a lot of times we don't even know that they enter our body. And that was the case with me. It's the case with, when we talk about Lyme disease, tick-borne microbes, that sort of thing. These are things that fly underneath the radar most of the time. That's what makes this thing so frustrating to conventional doctors and so difficult for people to understand is these microbes are really slow. They don't, they have a couple of different ways of bypassing the immune system. And what they want to do is not break down the door and tear us down. They just want a presence. That's all they care about. They want to get in, have a presence, get a little food, wait around until they have an opportunity to spread to another host. And they're good with that. They're happy. So it's like the microbes that I defined that I had in my system, I picked them up as a kid. I played in the woods. I was getting tick bites all the time. I got bitten by cats and hamsters and dogs and so I picked up a lot of things, but I didn't get sick then because I was healthy. I was young. My cells were healthy. My cells were young. But they entered my body and I struggled with this for years and years of where did they go? How did they maintain a presence inside my body? And that science has really come to light over the past 10 years. And it's really, really fascinating. So when we get bitten by a tick, when we get bitten by a dog, a hamster, when so many respiratory infections, a lot of things that we encounter bypass our immune system. The microbes in the immune system have been playing this game for a long, long time. And there's some stalemates that we've reached that the microbes get in, bypass the immune system, and they're able to persist in the body. And the primary things that they do to do that, so like Borrelia, the Lyme bacteria, other co-infections, Bartonella, Babesia, Anaplasma, and many others that we get not from ticks from other places like Bartonella is more commonly spread by other animals. And chlamydia we get as respiratory infections. Mycoplasmas we get as respiratory infections or pick up from other people sexually. These things enter our body and we don't necessarily get sick. They bypass the immune system. They grow very, very slowly. That's a big defense mechanism and it makes them very resistant to antibiotics. So I talked about pneumococcal bacteria turning over every 20 minutes, really aggressive. Borrelia, the Lyme bacteria, it doubles itself every 12 to 24 hours. That much difference, that slow. And that's true of all the other microbes that I just mentioned. They're very slow. They enter the body, they enter cells. They can enter red blood cells, white blood cells, but they can seed other cells in the body. So they invade cells. And if cells are healthy, they can actually become dormant inside the cell and just hang out and persist. And they can stay there. The cell keeps right on working. So if you can imagine your body seeded, like if you had a tick bite, your brain cells, muscle cells, heart cells became seeded. Not all the cells, but a few cells here and there, just kind of sporadically. But that happened multiple times over and over and over again in your life, and it creates a reservoir in your tissues of these opportunistic microbes that are just waiting for an opportunity. That opportunity comes when you eat a bad diet and you're exposed to chronic toxins, or you get really stressed and you stay stressed for a long time and you don't get any sleep, like happened to me, or you were in an automobile accident and you get really stressed and ended up in the hospital for a couple of months or something like that. Then these things start to reactivate. And when they start reactivating, they start breaking down other tissues, they start invading other tissues. And sometimes this can wax and wane depending on your health. It can get better, it can resolve on its own because your body is constantly trying to tamp this down. But you can reach a point that I call the boiling point. And the boiling point is when this reactivation of this reservoir of dormant microbes is happening so much that it's creating a more cellular stress that's fueling more microbe reactivation. And this is going on over and over. So it's a self-sustaining process. And that's where I was. So even though I quit doing obstetrics and had an opportunity to sleep, I couldn't sleep. My body was falling apart. I had heart issues. I had brain issues. My brain was on fire. Gut issues. My joints were falling apart. Everything in my body all at once, and nothing seems to stop it. And so at that point, I changed my diet, and that helped some. I cleaned up my environment. That helped some. I took medications to sleep. That helped some, but it didn't get me where I needed to be. And it wasn't until I broke that cycle with herbal therapy that I actually started getting better. And, so whether you're looking at chronic Lyme or any other chronic illness, I'm finding evidence of this microbe reactivation. I found that there's evidence that it could be happening in Hashimoto's thyroiditis. There's evidence that that's what's happening in multiple sclerosis. So virtually every chronic illness you look at, you can explain it better with that model than anything else. And so it really helps understand what not only chronic Lyme is, but what all chronic illnesses are. So, where I am now, I'm putting together a paper that takes all the evidence that I've been looking at over the past 2 decades, especially over the past decade, puts it all together, and it verifies everything that I just said.
It makes a lot of sense. So we work with people trying the carnivore elimination diet, seeing how much we can heal with reduction of noise, eating whole foods, and seeing how far they can reduce inflammation and feel better. We get many people feel a lot better, and then some people just only get better to a certain point. Then we started looking at mold illness, and the mycotoxins, water damage buildings. Again, many people get better, and then some people didn't. And we started noticing that there were other functional medicine doctors that would test a whole host of different viral infections. And so we just started tacking on to our mold illness panel, Epstein-Barr, just because we know that most people get it. And in that, more than trying to go after Epstein-Barr or is it viral, is it what is it? We're just seeing how much is your immune system being challenged by a virus that should be relatively dormant. And we started seeing people with high levels of mold illness or markers that are really imbalanced in their immune system, that their Epstein-Barr levels where their antibodies were also really high. Whether it was really activated or not, you could tell their immune system was struggling to keep EBV at bay. And so everything you're sharing is completely in line with what we've been seeing. So
Yep.
am I hearing from you then that some people, if they keep their cellular wellness, so all five things are, diet's good, environmental toxins are reduced, stress is reduced, making sure you're getting enough sleep and you're ensuring that maybe your gut health so the microbes are well in your system, then even if you got bit by a tick that had Borrelia, that it would never emerge as Lyme illness. Hey guys, just a really quick break. Nutrition with Judy's private practice is now called Empower Functional Health. I started as a nutritional therapist, but we have become much more all-encompassing. At Empower Functional Health, we do functional medicine, chronic illness, autoimmune, gut health, environmental illness such as SIRS, mold illness, Lyme. Regardless of all these names, the goal for us is always to get you root cause healing answers. And of course, carnivore, the all meat elimination diet is always on the table. Food, the right food, is always medicine. We offer functional tests, prescription meds, and really everything to get you closer to root cause, where you can just eat the meats you enjoy and live the life that you are meant to symptom-free. The goal is to get off meds, supplements, and everything else that your body no longer needs support in. Our practice, whether it's Nutrition with Judy, sharing podcasts and free content, or our private practice, Empower Functional Health, our goal is to support you guys in the barbell theory. We give a lot of free content, our evidence-based research. We don't use Substack. We give all our stuff away for free. We interview with the best and make it super tactical so you have clinical pearls that you can walk away with and try in your own healing journey. And then we work with some people in a smaller subset, one-on-one, to provide that level of personalized care. And as we heal these people that are chronically ill, we find these clinical pearls and golden nuggets that we can share then more publicly so that we can make wellness for all. Hopefully, the content and the guides and the free stuff we give out is enough for you to heal. But if it's not, you can always come and work with us in our private practice so that you can get more personalized care. If you want to learn more, make sure to check out empowerfunctionalhealth.com.
Yeah. And that's something that's really hard to define. There are things that we don't have access to evidence. I've speculated that if you checked everybody in the United States, or especially areas that we know that there are a lot of ticks like New England, and we were able to look inside every one of their cells and look for dormant bacteria, I think we would find that most people had evidence of these tick-borne microbes that were in their system. But we don't chop healthy people up and look at our cells, so we have to get it from bits and pieces, like from random biopsies here and there. And, whether you're looking at cancer or, brain autopsies or whatever, if they look for microbes, they find it. But it's not like one or two things. It's dozens or hundreds of things that they find. So the fact of the matter is, we used to think of our tissues in our bloodstream as sterile, and it turns out that it's probably more like a freeway, that things are constantly, right now while you and I are talking, things are crossing over from our gums, our sinuses, our gut, entering our bloodstream and ending up in our tissues. So that was another fascinating thing is studies that have suggested that, actually we things that we have in places that are supposed to be isolated from our tissues, like our gut and our gums and our mouth, those kinds of microbes end up in cardiovascular plaques, they end up in brain tissue, they end up all through the body, but often they're in a dormant state inside cells, so they don't bother us. So it's yeah, once you start digging into this, it really does get interesting.
So would you say that if someone hit your boiling point with the definition where now your body can't handle the level of microbes, whether they were dormant and now they're reactivated, or it's just more newer, do you then have them go through the first four steps of healing, or do you start the herbals initially?
Yeah, with steps of healing, um, depends on the person. I've developed a new protocol that the first thing we do is we start working on sympathetic overactivity, that disengaged vagal tone of this hyperactive alert system. And it's like if all the cells in your body are stressed, they're constantly bombarding the brain with distress signals. Your brain is on fire. It has microbes in it that are reactivated. So, you have to do that because that's affecting sleep. It's affecting gut. It's blocking detoxification. So, taking the time to help people override that mechanism is really important. And we start people out on just we start them on antimicrobial herbs, but very gently in the beginning, because if their system is overwhelmed, if their body is in turmoil, a lot of times if you dump too much in there, it's going to really upset the apple cart. So we do that for a couple of months, and then we move into diet and detoxification, and finally bring on some really strong, potent antimicrobial herbs later in the game. It's really important. But without the herbal aspect, it's really hard to move forward in a lot of people.
There are people in the Lyme specific space that will put individuals on antibiotics for years. And then there's people that will use herbals. Do you ever see a situation where like IV antibiotics long term for years is necessary? Or do you think that the herbal treatments is enough to get people healing?
I'm becoming more and more an advocate against
Okay.
antibiotics, and there are very, very good reasons for that.
Okay.
So you have to pick the therapy that fits the problem, right? So that pneumococcal bacteria that I talked about that's growing very, very fast, it's invading cells from the exterior. Antibiotics really get to that. So fast growth, the growth rate is really important for an antibiotic to work. The faster something is growing, the quicker that it's going to solve the problem. So you can get somebody well in several days to a week with IV antibiotics with a really bad pneumonia, unless their total immune system is collapsed, and then nothing's going to help them. So antibiotics don't completely solve the problem, but they knock things down enough that the immune system can help out. The problem with antibiotics is threefold, and this is really important. And it means that you have a limited window that you're going to be able to get best use of antibiotics. And that is all antibiotics disrupt gut flora. That's going to be a big problem. So when you take an antibiotic, you're hitting that fast growing microbe really hard, but you're also hitting flora, your normal gut flora in your gut. And you're hitting them harder than you actually are the microbes that are dormant and slow growing in your tissues. So you've got about 10 days before you start disrupting somebody's gut, and they can take probiotics and all of that, but it's still not going to solve the problem. They're still going to get disruption. So when you kill the normal flora, those are the things that are suppressing pathogens in your gut that are some really bad actors like C. diff and Candida and things like that. They're there. Everybody has them, but your normal flora are keeping them suppressed. The second thing is antibiotic resistant pathogens. All it takes is 10 days for an antibiotic to start becoming resistant to whatever you're targeting. And that's an enormous problem because we don't have any new antibiotics. The last new antibiotic was made in 1985 when I graduated from medical school 40 years ago. New antibiotics. And so we've used antibiotics. It's such widespread that there's antibiotic resistant pathogens to all of them. So when we look at chronic illnesses like fibromyalgia, chronic Lyme, people don't necessarily die of them. They may die of complications later, but they don't die of that. 1 million people, and this is growing every year, 1 million people die of antibiotic resistant pathogens every single year. 1 million. Getting worse every year. That's been happening since the 90s. So that's an enormous problem. And so when somebody does 6 months of antibiotics, they're not only contributing to that problem, but they are also generating antibiotic resistant pathogens within their body. The third thing is antibiotics are toxic to cells and mitochondria. You can't get well with something that's toxic to your cells. That's the original problem. So that's the advantage of herbs, that you don't have those problems. They don't disrupt gut flora. In fact, herbs actually improve the balance of gut flora. They suppress pathogens in your gut. They don't generate resistant pathogens. And they actually are very beneficial for your cells and mitochondria. So, what that means is you can use herbs for 6 months or 6 years, or in my case, 20 years. I've been taking herbs continually for 20 years, not at the doses that I once did, but I've been taking them continually, and I've experienced some of the best health in my life over the past decade that I've been taking herbs. And they just continue to surprise me. So it's a very different thing. Now, the antimicrobial properties of herbs have been well documented. There have been studies out of Johns Hopkins and similar institutions saying that they kill Borrelia and some of these other microbes as well as antibiotics. So it really is a much smarter solution. And what it boils down to is whatever you're doing, and I found this out in my recovery, whatever you're doing, if like if you use antibiotics or IV ozone or whatever kinds of things you're doing to kill microbes, you're killing the active microbes, but you're not getting the rest of that dormant reservoir that's in your tissues. So as soon as you stop that therapy, if you haven't restored cellular wellness, you haven't restored the health of your cells, it's coming back. And that's what happens to people. They do these really expensive invasive therapies. They get better for a couple months, and then they're right back when they started. And I learned this in my recovery. I would do the herbs, and it was kind of a pain to keep up with all of it. And I would stop doing them, and I would, get hit with stress, and I'd be right back to where I started again. I was having reactivation again. And so I finally reached the point that it's kind of like, I feel better on the herbs. It's not wrecking my gut like antibiotics did. I'm going to just keep doing it. And that's the advantage of the herbs, is you can continue them long term. You can't do that with any herbs, but the herbs that I'm talking about, I'm starting to call them adaptogenic antimicrobial herbs because they have a lot of adaptogenic properties, like our adaptogens we make us more stress resilient, and they're doing that by protecting our cells, but they don't have drug-like effects or drug-like side effects so that we can take them for a long time. And there's certain herbs that that fit into that category. They don't have drug-like effects, so their effects are basically promoting healing, and part of that is suppressing these vagrant microbes in our system. So we can take them for 6 months or much longer and keep the pressure on until our body is completely well, completely able to get back on its feet. That's the simple message for folks. I think people though get anxious, and it's like, oh, this hadn't worked in 3 months, or I need to do something else, and then something else, and then something else, and the next thing they know, they're a couple $100,000 into this
Right.
thing. And it's like, just get on the herbs, keep taking them, keep doing this stuff, and your body will heal itself. So it's a simple message, but it's hard to get people to do it sometimes because it is so simple.
Right. I think the hardest thing is people want solutions yesterday. And so if
Yeah.
there's not a quick fix, something that overnight magically heals you, then it's probably not the right answer. Or that's how we've become accustomed with
Yep.
all the things in our modern life and society. But so we've had many people use herbals such as cat's claw or Japanese knotweed. So what are your favorite herbals to start with? And then long term, what were some of I guess, the heavy hitters that you use?
I have a lot of favorite herbs,
Okay.
but there are ones that have been studied better than others. And
Okay.
part of that is because people started using them, they found benefits, or other people used them, and kind of word got around about those herbs. And then finally in 2020, researchers at Johns Hopkins and others around the country started looking at, well, what about these herbs that people have been using a lot? Let's see if they really work. So some you mentioned, cat's claw, Japanese knotweed, Chinese skullcap is a favorite. Garlic is a really nice herb. These are the ones that have more data than anything else. Adding to that list, a favorite, it's not quite as good for Borrelia, but it's great for parasites and things like Babesia and viruses. Andrographis is a really nice herb. And I tend to pair it with other adaptogens and immune modulating herbs. Because the key thing about these herbs, compared to say like echinacea or elderberry that we might take with an acute virus, is those are immune stimulants. They rev our immune system up. We don't really want that. We want what are called immune modulators. So immune modulators are things that calm the overactive portions of our immune system down, like exaggeration to allergic reactions, but boost up the ability of the immune system to take care of these intracellular microbes. So, immune modulators. So, all of those herbs are immune modulators, are adaptogens. Some of our medicinal mushrooms like reishi and cordyceps are really good immune modulators. And they do this, it's like, well, how do they normalize the cytokines and all of this and reduce inflammation? They do it by protecting cells. So, all of these things that we define as immune modulators and adaptogens, what they're doing is in intense cellular protection of not only the cells that make up our body, but our immune cells. They're protecting immune cells from stress, from microbe stress, from free radicals, from toxic substances, from all the things that are the enemies that are making our cells sick. The herbs are counteracting those things. And when you do that, all the inflammatory messengers go down and our hormones start balancing and things come back online and start working again.
When do you start noticing the shift? And I only ask that because some people will take it for a month and they'll say, so there's a couple things. One, they'll say, I don't feel a difference. The other thing people will say is, oh, I'm having a histamine response, or maybe it's because I'm sensitive to sulfur or any types of plant herbals. And so then they're sensitive and then they have to go really slow. But
Yeah.
if they can tolerate it, when can they tolerate it? And then two, at what point do they start to see a shift in, oh, I am feeling a little bit better?
Sure. Well, yeah, every person is an individual, and we certainly have people that have to go very slow. They're dealing with chemical sensitivities, And, it is sometimes kind of a dance to figure out which herbs you can take and how things work. But fortunately, 50 to 70% of people can progress with the herbs fairly well and get into a routine that works very well. Um, we actually have been studying that. So we've been doing herbal protocols for these conditions, and not just chronic Lyme, fibromyalgia, all of them. I throw them all together because I think they're all rooted in reactivation of different kinds of microbes. We've been doing surveys on just seeing how people respond to these things. And generally, by 6 months, 70% of people are seeing a reduction in symptoms. The people that can start the herbs, go right on a protocol and do well with it. At 3 months, they're about 30% of seeing something pretty significant. But 6 months and then 9 months, it's even as high as 90%. So, but it takes time. So a lot's going on. It's not just, you don't just take the herbs and suddenly the problem is gone. You're suppressing these microbe reactivations, you're healing cells, and that healing process takes a lot of time, especially for certain cells like heart cells and nerve cells. It took probably 5 years total for all of my heart and neurological symptoms to go away completely. But the amazing thing is they did. I mean, when I was 47, I couldn't walk a half a mile, and my heart, I had continual chest pain. I ended up having a cardiac cath. They found that my vessels were clear, but they said, you got something going on. You got a lot of damage there. I was having skip beats, PVCs every second to third beat. I mean, it was really distressing. And the drugs just made me feel horrible. I couldn't take them. And I finally just kind of gave in to it. And over about a 5 year period, it all went away. And I'm sure I have some scar tissue there, but it's amazing what your body can do. I mean, I'm out there doing things that I never thought that I'd be able to do again, like kite surfing and biking 10 or 20 miles and things like that.
Are there certain protocols or herbals that you start with in general? I mean, I know you have a protocol that you would generally recommend. Where
Right.
can people get started?
What we do, I've got a brand new program that we've been building for over a year, that we call Restore 180. And, part of it was we've been doing this for a long time, but learning that the really, really high potency extracts, a lot of people struggle with that. And so our attrition of people falling off the program was pretty high. And so we stepped back, and created this really curated program that carries through people through a crop process. There's a community that goes along with it. There's a lot of support. I built an intense educational system that people go through. And so we start them off with herbs that are calming to calm that sympathetic overactivity, like ashwagandha and other calming herbs. And I start them off with a tincture that's well tolerated with cryptolepis, which is another great herb, and several others in it. But it's not as potent. It's not, we're not clobbering things. It's well tolerated. So it gets them started with antimicrobials, but not as intensely. By the end of the program, we've calmed the sympathetic overactivity. We've got their gut working again. We go through elimination protocols and detoxification protocols. And finally, like the fifth or sixth month, we start the really, really potent, high concentration extracts. These are powdered extracts that are, basically 10 times what you would find in an average product. So really intense. And that's Japanese knotweed and some of the other herbs that we've mentioned. So far, we just graduated our first group, and we had 90% retention through the whole program, which is pretty amazing. And they're all having benefit. And not to say that everybody is well. We didn't really expect that. but they're in a better place. They know what they have to do, and they're on a good course that they can keep going with the herbs as long as they need to end up in that space of defining being well.
How much do you think that biofilm breakers, binders are necessary in this whole cellular wellness picture?
Less than people think.
Okay.
I think this is a big thing with a lot of the Lyme community of looking for reasons why all those antibiotics didn't work.
Mhm.
And I think the big problem with the antibiotics is they make people sick.
Right.
And so if biofilms are a factor, there's no doubt about it. We have biofilms in our body, but biofilms don't explain the symptoms of chronic Lyme disease, where reactivation of microbes in tissues and cells does. And I think right from the get-go, that's the primary problem. Biofilms become a problem later when your body is breaking down and your immune system can't defend itself. It can't take care of those things anymore. It's like, if you look at someone with bad plaque around their teeth, they're generally it's people that have really bad health habits. So the worse your health habits, the more plaque you're going to have because your immune system can't manage that kind of plaque. So we see biofilm when in later stages of disease when the immune system is really broken down. So the best thing for biofilm is a healthy immune system. I mean that's what's going to take care of the biofilms. And quite frankly, we found that a lot of the herbs help with biofilms. Well, how do they do that? Well, they take the load off the immune system so the immune system can actually take down the biofilms, and that's the best biofilm buster is your immune system. Yeah,
No,
it's a
I
big important
completely
thing.
am on the same page with you. I think that in the wellness space, when things aren't working enough, whether it's the mold space, then they're like maybe it's this other thing, and then in the Lyme space, maybe it's the biofilms or this. But sometimes maybe we have to look a little bit more holistically to find
Right.
solutions. Otherwise, people are always chasing the next big protocol, the next big supplement, the next big this, and usually though not
Yeah.
everyone is going after those solutions, yet other people are healing. So to me, that just holistically makes me think that is not the answer for everybody. Then that means maybe that's
Right.
not the real underlying solution.
Yeah. 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 It's true. Sometimes it's the things that aren't expensive that make the most sense that do the most for us.
Right. I've worked with some people that have a lot of resources. And so the beauty with working with those individuals is you get to see all the different, biohacks that they have money to spend on.
Yeah.
And it doesn't always work. And I think it's because I don't think the answer is we are just missing this one medication or this one supplement or this one protocol
Yeah.
or biohack. It's really that, like you said, the whole system has to work a lot more harmoniously. And when we
Right.
are attacking the body more, even with the most fanciest gadgets, the risk is what are we doing downstream to the body? So did we also nuke the immune system as we're going through these new biohacks? And that's the bigger concern.
I think that's a big thing, and I spend a lot of time looking at therapies for people, and I use 5 criteria for really understanding, or 4 criteria. Efficacy, does it have any evidence? And that's not necessarily just a double-blind study. There
Okay.
haven't been any big double-blind studies on people on herbal therapy, but we have tens of thousands of people who've gained benefit. So efficacy is important. Safety, something that has a lot of efficacy, but is it going to make you really sick? Yeah, maybe not. Cost, that's a big one. So, and logistics, how difficult is it for the patient to actually use that therapy? And finally, the fifth one is it supportive? Is it just reducing symptoms, or is it actually promoting, is it enhancing healing in some way? And, when it boils down to it, the things that are going to be most valuable are the things that are enhancing cellular recovery in some way. And there are a lot of things out there that don't do that. They're just killing microbes or whatever. And you just can't get well with things that are toxic to your cells. It's really as simple as that.
Yeah, I love it. I love it because we have an immune system and we don't
Yeah.
understand certain parts of the body still, even what all makes up our microbes. Every single gut doctor I've ever talked to or that specializes in, the gut, they only or there's a hyper focus on bacteria, but what about all the other microbes? Like what else is going on in the gut?
Right.
And so I think what you're sharing makes so much sense. The goal should be to strengthen our own body, our own immune system to be able to handle this world.
Truly.
And so every protocol that we take that kills is there's a risk of how much are we also impacting our immune system. And so that is that risk reward that we must always consider when taking antibiotics, antifungals, anti whatevers, and antimicrobials from a medicated perspective. And I don't think there's enough conversation in that. And that's why I think everyone chases the next big biohack, but usually it's more internal. There's things that we need to work on. And one thing that I love that you brought up is when you are recommending herbals to put our bodies in more of a calm state, the nervous system, dysregulation, trauma, stress, all of those are very, very real in keeping our bodies in this chronic cortisol
Mhm.
state. So I was curious, how much do you also work on having people, use breathing exercises and exercises to reduce the noise of the nervous system when it's in a chronic stress state? Because when people are not well, they start looking down every road to answers and they feel overwhelmed, and that itself is
Right.
also injury to the system.
It is, yeah. I mean, it's yeah, that's why we try to just get people to say, "Hey, just put everything else on hold right now and just do these things." And and it's amazing how powerful they are. But yes, breathing exercises, personally I do qigong, I do yoga, and but just frankly, getting out and walking. I mean, just anything that you can do to calm that sympathetic overactivity. Now, you have to recognize that when you're chronically ill, chronic illness is a state of extreme cellular stress and dysfunction. Every one of those distress cells is sending distress signals to the brain. It's getting bombarded 24/7. So the brain is just in this constant place of high alert. Well, it's going to take time to fix that, months or even years, but you have to learn to short circuit that response. And that's what brain retraining, relaxation exercises, qigong, yoga, all of these things are really important. And sometimes herbs can help kind of give people a little bit of an edge without being a burden later, like sleep medications and benzodiazepines and things like that. But they're not going to, you can't just take an herb and go, oh yeah, everything's going to be great now. You have to do that work yourself. And it does have to be an integral part of the whole thing. And but it's like so many other kinds of problems. Everybody's chasing diet for gut dysfunction, and the primary thing that's disturbing our gut is sympathetic overactivity. If your brain's on fire, if you're in high alert, your brain puts basic maintenance functions like digesting food on hold. Like if you're running from a tiger, digesting food isn't the issue. It's getting away from the tiger. Well, that's what your body is thinking. So you have slow motility. It shuts your gut down. Everything gets backed up. People have reflux and stomach ulcers and SIBO and constipation, and all of it is related to sympathetic nervous system dysregulation. And so you have to solve that problem before you can start doing the gut, before you can start detoxifying the body and those kinds of things. So it's doing it in stages, and it's just really important to go through those steps.
Right. I think it's such a balance because for somebody that's so dysregulated to have them even do breathing exercises, it becomes really hard. So
It
maybe
is.
some herbals will allow the body to just calm down a little bit. We still need to eat every day. So if we can have the person even calm down just for a little bit, whether it's prayer, whether it's setting the table, just to get in a rest and digest so that they can get some of the nutrition, I mean, that would be so ideal because whatever raw materials the body gets, it's able to use that then for the immune system to thrive. So it's
Yeah.
it's all of that, and it's just a fine dance. It's very individualized, and so that's where it gets so tricky. In terms of the microbe space, from you working with herbals for so long, I know that there are like antimicrobials, and then there's other herbals that may be more fungal driven or bacterial driven. And so I'm curious your thoughts when you see illnesses like Lyme, where some of it's bacterial, and then I know some of it's like a parasite, and then there's mold, and then there's like EBV, which is a viral. Do you see that there are bigger ones that you have to hit first?
Yeah, here's a way to think about herbs. So herbs are either plants or we can, medicinal mushrooms fall into
Right.
that category too. They're living organisms. And those living organisms, plants have to defend themselves from a wide range of bacteria and viruses and protozoa and other microbes. Plants have to defend themselves against free radicals and toxic substances and radiation and all the other things going on in that environment. Unlike our system, that we have a cellular immune system, plants basically have a chemical immune system, and fungi have a chemical immune system. So they're solving that problem with chemistry, basically. And so when you look at a plant, whatever properties that we find that it is valuable for is a reflection of whatever it's having to solve in its environment and how it chooses to do it. So some plants may have certain kinds of microbe stress that are stronger in that particular whatever their native environment is. But some plants just don't mesh well. They make choices that aren't compatible with our biochemistry, like you wouldn't want to use poison ivy as a medicinal, right? So the plants that we define are herbs are things that humans have been using for thousands and thousands of years. So we have a really good track record. And our chemistry, our genetic chemistry, we recognize these things. So when we take them in their body, we're getting widespread coverage. So that's the cool thing about plants. So when we look at antibiotics, antibiotics actually come, all of our antibiotics originally came from a natural source, every one of them, either a plant, a bacteria, or a fungus. But instead of taking that whole plant's or a fungus's system, we just pulled one chemical. And because we can't patent a chemical that is natural, we change the chemical and make it more potent. So it's one single chemical, and that's pretty easy for viruses and bacteria and other things to get around. When you've got an herb, you're talking about thousands of chemicals. You're borrowing that plant's whole defense system. But it also includes regulatory chemicals that the plant is using to regulate the change cellular functions from day to night, from different weather, different seasons. And a lot of those chemical messengers are similar to chemical messengers we use. So a lot of them can have a positive or negative influence. It's like caffeine. Caffeine is a chemical that plants use to regulate cellular functions. Well, it's stimulating for us. A lot of chemicals that plants have are calming for us. So different plants, how they have to survive in their environment and can influence how that plant works. So it is true, some things are better antivirals or better antibacterials, but what I'm finding is that all plants, every single herb, all herbs have antimicrobial properties. Over time, we found that maybe one, it's like Japanese knotweed, we know is good for Bartonella, Babesia, good antiviral and antifungal too. So it does have some broad spectrum antimicrobials. We don't think of, say, reishi or cordyceps as really strong antimicrobials. We're doing them more for their adaptogenic qualities. Reishi has some really great antiviral properties against Epstein-Barr, especially. Cordyceps, the same, and it actually has some anti-Borrelia, anti-Lyme disease characteristics. So you're getting a lot more broad spectrum, which means you don't have to work as hard. You get some good basic herbs in an assortment. And the nice thing about herbs, because their potential for side effects is so low, you can use a spectrum of multiple herbs. In fact, that's a key part of herbalism is using formulas with 5 to 10 herbs in them. So using multiple herbs to get that synergy really can enhance the benefits you get out of them.
Let me ask you about hormones then in this whole conversation. So obviously a lot of people use bioidentical hormones. They say it's safer than the ones that are made from like horse's urine. But what are your thoughts with that, especially taking BHRTs?
I think there's a place and purpose for everything. And when we look at hormones, I think it's important to recognize that what hormones do is communication, is cellular communication. For the body to function as a unit, all the cells in the body have to be in constant communication with all the other cells in the body. So every hormone is sending a message to different cells and sometimes all the cells in the body. It's like every cell in the body has estrogen receptors. It needs to know what's going on in the reproductive system. So the brain is overseeing what's going on inside and outside the body and making adjustments through nerves and hormones. So we have literally thousands and thousands of chemical messengers in the body, and that is very dynamic. It's like a conversation that's going on between cells that's constantly changing. So you have to be really careful about hormone replacement because we don't really know the language very well, you know? And so when you just dump in a bunch of hormones, then this static message into this very dynamic communication, you can really mess things up. So you got to be careful. So it works in certain cases, like postmenopausal hormone, the ovaries stop producing estrogen sometimes very abruptly. And then because every cell in the body is depending on that message, it can really kind of yank the rug out from underneath and cause a whole series of different problems just because it's very disruptive when that happens. So a very low dose of bioidentical hormone, estrogen, sometimes a little testosterone, can be helpful to substitute in for what the ovaries were doing. But that's a rare case, you know. Another rare case is like thyroid hormone. If you burn out enough thyroid cells, you don't have enough thyroid hormone to keep up. So you need a little bit of replacement just to compensate. But there's a lot of difference between someone who's burned out a lot of their thyroid to someone who has their whole thyroid removed, like for a tumor or something. You remove the whole thyroid gland and replace the thyroid. It's really, you lose that dynamic state. So people who have no ability to produce any thyroid hormone really struggle. So a lot of, people out there are using peptides and, growth hormone and testosterone and these kinds of different things. There is just a lot of potential to mess things up. And I think about it this way, it's like our cells are all communicating, they're working together. And it's like if you had a room of people sitting around a table trying to solve a problem, and there's this dynamic conversation going on, and it's going around and around the table trying to solve this really complex problem. And somebody walks in the room and throws down a soapbox and stands up on it with a bullhorn and starts screaming one word. That's kind of what we're doing, or what we get. What the potential problem with just dumping in a hormone is, we're not part of that conversation, and we're not necessarily leading the conversation. We can even be disrupting the conversation. So you have to be very, very careful about how you administer hormones, and whether you're just doing a little bit to help the situation out, or whether you're trying to override something that's a dysfunctional process. So the answer is always you have to restore normal cellular functions. And hormones are important when those cellular functions are gone. Another example is type 1 diabetes. You've lost all the cells that produced insulin in your pancreas. You have to have those to survive. So there's situations where the cells are gone. But in most situations, like adrenal fatigue and a lot of things that we hear about in chronic illness, if you're restoring cellular functions, you're also going to be restoring the cells that are producing the hormones, and you're restoring that normal conversation. And that's how you get things back to actually normal, that your body can function like it's supposed to.
And then you mentioned peptides. So what are some of the risks that you mentioned with using peptides?
Yeah. There are some people that have gotten benefit from peptide and I want to recognize that there are practitioners that have found a formula that actually works for people. I tried like BBC 157, other kinds of things, injections, sublingual, didn't notice it did anything, quite frankly. It's again, it's that message. You've got this, the what those peptides, you have to ask, what's the purpose of this thing in the body? And hormones, peptide hormones are messaging. They're defining messages between different kinds of cells in the body. And it's a very dynamic conversation. So any kind of hormone that you introduce, peptides or otherwise, have the potential for being disruptive. So a lot of people don't respond. And I'm always a big advocate of let's restore the normal cellular functions as much as we possibly can. And if we reach a point where that doesn't exist anymore, then sometimes we're forced into using hormones or signaling agents of some kind, but it's never ideal. So it's always best to do something that's going to restore that normal balance of messaging in the body rather than trying to fix it.
So are all peptides considered hormones?
Sure. Well,
Okay,
they're
okay.
signaling agents,
Right,
right?
right.
I
I never
mean,
thought of
they're
it
all
that way. I just
signaling
thought they
agents.
were something so different of
Yeah,
okay, I can totally see that.
they're different kinds of hormones,
Sure.
right? And they're different kinds of signaling agents. Our cells even use photons, light to
Mhm.
communicate. That's
Right.
been defined. So cells, the messaging is so complex in the body between cells, and we don't understand it. I mean, we just don't completely understand the language. We understand so much, but there's a whole lot we don't understand still. So you have to be careful with how you go about it. And always, anytime you can restore cellular functions, that's going to be a better alternative than anything else you can do.
So if someone was watching this, and a lot of our listeners and audience is more carnivore based, so there's a lot of fear around plant based. Although I feel like more of our audience is more open because they're just chronically ill and the diet is not doing enough. And it's not because it's just carnivore, it's just any elimination diet isn't working perfect enough. And so they have to go into herbals or treatments because they need more care than just the diet. Where should people get started? So should people read a book on, you have a cellular wellness book, it's excellent. Should they start to learn about the herbs? Do you have or should they start your program? Where do you recommend?
Sure. Yeah. Any of those sources
Okay.
work. People that come in our program, they're going to learn about or using herbology all the way through the thing, and they're going to be exposed to different herbs that aren't going to hurt them. I mean, that's the thing that I'm really particular about is using herbs that have a very, very low potential for harm. That's something that I did in that book, the cellular wellness book is like four books. So the first book is about 100 pages and it's about that cellular wellness concept. The second book is a primer on herbs to
Mhm.
really help people understand herbs from a science-based point of view rather than traditional herbalism point
Okay.
of view. So it's a little bit easier to understand and it makes more sense because it's how, it's what the phytochemicals of the plants are actually doing in the body, to our cells, to our body, to microbes. So it helps people. And I define in that book a green zone of herbs. So when you look at herbs, it's everything from food plants and culinary herbs all the way to herbs that do have strong drug-like effects or are even poisonous. I generally stay away from those herbs. So I've defined what I call a green zone that are herbs that have low potential for toxic or drug-like effects that people can take long term that are relatively safe or have a low potential for harm that they can't get in trouble with. And so that's a great place for anyone to start. So it's adaptogens and these adaptogenic antimicrobial herbs that I talk about. And those things, it's pretty comfortable for people. It's a great place to start.
Yeah, it's closer to do no harm that I think than some of the medications that are being used. How important is sourcing?
Really important. Yeah, just getting the right stuff. That's something just had interesting side story. As I was getting into this myself, I had stopped practicing obstetrics and I wanted to, but I had to make a living. So I started a primary care practice with this idea of doing a wellness practice. And it kind of evolved into what we would define as a functional medicine practice today. But part of that was getting people on these herbs. And so I was in a small town and people didn't have access to good products. So I started carrying products in my office, but I was still having a hard time finding things that were of the good quality or the combinations that I wanted because nobody was really doing these antimicrobial herbs or really knew very much about them. And it wasn't something you could find in a health food store. So I had this odd situation of I called up one of the big manufacturers, supplement manufacturers, and asked them if they would make products to my specifications, to the actual specifications of me sourcing the ingredients and having them sent and having products made. Unbelievably, they said yes, and they were doing, runs of like 100 bottles for me, which was you can't do that anymore. Nobody would do that. Not a supplement company in the country would do it. But I was able to learn from that, and I started formulating my own products, and gradually my daughter came on board, and we built that into a company called Bioplan. That opportunity was really golden because I started being able to create things to my specific specifications. And so it's sourcing, it's getting ingredients that you can find the source all the way to the farm. It's getting a certificate of analysis, which tells you that it is the correct extract, it's the potency that you're looking for. So I'm using, from the beginning, I started using really high grade extracts that are like 10 times more potent than what you would find at a health food store in most cases, or what most people are finding when they buy a product on the market. So these are really concentrated, sourcing them to the right source, getting the testing. And now we do several levels of testing in the whole process, all the way through the manufacturing to make sure that the quality of the product, the potency of the product, and is going to meet people's expectations. And I think that's why people fall short with herbal therapy. They're using products that just aren't very potent
Right.
when some products don't even have the herbs that they think they do. If you buy a proprietary blend and it gives a milligram quantity and it lists just a whole bunch of herbs, chances are there's no telling what you're getting in that thing.
Right.
It is the wild, wild west out there, and you can pay a lot of money for really crappy supplements.
Mhm.
And when they're putting all their money into marketing hype, and it just sounds so impressive. Everything, all the science they're throwing at people, and so. But a red flag is if if you're reading in a magazine or on a website or whatever, and they're throwing all this science of how wonderful this particular thing is and that sort of thing, but you have a lot hard time finding the actual ingredients. And
Mhm.
once you get to the actual ingredients, you find that they don't put much information. They just list a proprietary blend or whatever. That's a big red flag because you're really not getting what you're paying for.
As we close, I'd love to hear a healing story other than yours, which has been remarkable too. And thank you for sharing that. But do you have a healing story of maybe one of your patients or somebody that's, gone through your program and has really come out the other end from not being able to be well and to now being well, supporting their cellular wellness?
Oh my goodness. There are hundreds, there are thousands of them. I mean, just truly, the people, the responses that we've gotten of the people, it takes a person that is proactive and willing to just sign on to this thing and stay with it for a long time. And the people that do that get well. But one of my earliest stories, when I was really starting to figure this out, I was in this little practice and I was developing a reputation for being able to help the unhelpable. And I was getting people that were not helped, that have chronic illnesses. And they were, and I had these protocols of diet and lifestyle and all these things and taking this herbal protocol that I was putting together. And I was still learning at that point. But I had a patient with multiple sclerosis who came in a wheelchair and she wasn't responding to the drugs. And she was afraid. And she said, like, what do I got to lose? Sure, I'll do your protocol. It's not going to hurt me. I said, no, no, it's just diet and herbs and things like that. Within 6 weeks, she was walking with a cane. And, so the body is always trying to heal itself. And what I mean by that is your cells are always trying to overcome whatever stress that is stopping them from functioning properly. And if you get rid of those stresses, and that can be microbe stress, but all the other stresses along with it, your cells are going to respond. So, what healing is, fundamentally, what healing is the ability of cells in the body to recover from stress and dysfunction. And our capacity to recover is extremely high. Now, there are situations where you lose enough cells that you aren't going to get them back. Like if you lose enough thyroid cells, you may have to take thyroid hormone. But I'm just amazed at how much people can get back of the ability of cells in the body to recover if you create that environment inside that allows them to do that.
Thank you. I love it so much. I'm on the same page with you. Where can people find your program, your book? I have your book and I highly recommend it. Where can
Oh,
people
thank you.
find you?
The Cellular Wellness Solution is on Amazon and other booksellers. Pretty easy to find. Our company is vitalplan.com, and we have a lot of products, but mainly programs and pathways for people to follow, not designed to exclude a provider, to be used in conjunction with a
Okay.
provider to get a better response. And then I also have just an informational website called Rawls MD. So they can find it at rawlsmd.com. If they put /resources, it will tell about this new program I developed. Yeah, we're helping a lot of people. That's what it's all about.
Yeah, thank you so much. And thank you for sharing your journey and working towards finding solutions so that people don't have to suffer for long and understand that cellular wellness is so key and making our terrain or our immune system, our body stronger is ultimately the goal so that we can get better and live the life that we're supposed to. So thank you so much.
Well, thank you for having me. I really appreciate the opportunity.
I hope you guys enjoyed this conversation. Dr. Rawls is a wealth of information. We talked quite a bit even after recording, and he shared how much he's healed. He talked about how in his late 40s, he was barely able to walk maybe half a mile, and now he's able to do a lot of exercise and movement. His joints were really messed up and he thought he would have to do a lot of joint replacement surgeries and he's had none. And so this conversation of healing is so important and getting to the root cause or cellular wellness is so important. It's what I advocate for on this channel. It's what I hope to empower you with as you go through your chronic illness journey. I know we search for these silver bullets of healing and answers that will just poof, make us all better. But we didn't get sick overnight. And oftentimes it takes a lot of effort to heal. But healing is possible. Your body wants you to be better and to thrive and to live another day in wellness. And if we give it the right tools, the right raw elements, it can heal. And we have to, first of all, believe that we can heal because so much of the messages to our brain and then back to the body really impacts our healing and our wellness. No matter what protocols or remedies you use for healing, the goal should always be, is this hurting or helping my body? Is it a temporary hurt while we're doing a bigger battle that may benefit the body long term? And so for antibiotics for a acute case, that might make sense. But long term, we have to consider, is our modalities for healing going to support the body? And ultimately, that's probably the best place or best route to go. And that's why diet is so important. I highly recommend looking at Dr. Rawls' book, checking out his websites. There's a lot of information. And most of all, maybe just starting to learn a little bit about herbals, as herbals can support us as long as they're used correctly. Because remember, they are plant chemicals. And so just like anti-nutrients can be toxic to the body, some of these medicinally can also benefit, especially if we have microbes from other plants or other toxins from this world that are harming us. And so we can strategically then use these plant toxins or plant chemicals to then help us rid ourselves of the things that are making us not well. Just something to think about. Okay, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.